What is meningitis? Meningitis is an inflammation of the meninges. The meninges are the three membranes that cover and protect the brain and spinal cord. Meningitis usually occurs when fluid surrounding those membranes becomes infected. Mostly meningitis caused by viral and bacterial infections. Other causes may include cancer, chemical irritation, fungi or drug allergies. Some viral and bacterial meningitis are contagious. They can be transmitted through sneezing, coughing or close contact. Pathophysiology: first, organism enters the central nervous system, through circulation as a consequence of other infections, or direct route, such as penetrating trauma, or surgical procedures on the skull. Then the organism enters the arachnoid space, and initiate an inflammatory process which affects the layers of the meninges and CSF of the brain. The inflammatory response tends to increase CSF production and increase in ICP. The inflammation may spread and affect spinal and cranial nerves, which causes neurological symptoms. It's not easy to identify the symptoms of meningitis. People often confuse the early signs and symptoms of meningitis with flu, so it's important to stay alert, learn the hallmark signs and symptoms of meningitis, and act quickly if any of them occur. This may help save a life. They can vary depending on the cause. These symptoms may include fever, neck stiffness, headaches, nausea and vomiting, confusion and disorientation, drowsiness or sluggishness, sensitivity to bright light, poor appetite, abnormal skin color, stomach cramps, ice-cold hands and feet, skin rash, muscle ache or joint pain, rapid breathing, chills. More severe symptoms include seizure and coma. Complications typically associated with meningitis may include seizures, hearing loss, vision loss, memory problems, arthritis, migraine headaches, brain damage, subdural empyema, or a buildup of fluid between the brain and the skull.
To diagnose patient with meningitis, he may undergo the following diagnostic tests: blood cultures. Blood samples are placed in a special dish to look for any growth of microorganisms, particularly bacteria. It may also be studied under the microscope. Imaging. Through computed tomography or MRI, scans of the head which may show swelling or inflammation. X-rays or computed tomography scans of the chest or sinuses also may show infection in other areas that may be associated with meningitis. Spinal tap, lumbar puncture. For a definitive diagnosis of meningitis, cerebrospinal fluid, CSF, must be collected through this procedure. In people with meningitis, the CSF often shows a low glucose level along with an increased white blood cell count and increased protein. Medical management mostly depends on an early administration of antimicrobial agents that cross the blood-brain barrier in sufficient concentration in order to inhibit their multiplication. It's determined based on the cause of meningitis. For instance, bacterial meningitis is treated with intravenous antibiotics, depending on the bacteria involved. Fungal meningitis is treated with antifungal agents. Parasitic meningitis may either involve treating just the symptoms, or attempting to treat the infection directly. Viral meningitis may resolve on itself, but some causes should be treated with intravenous antiviral medications. Most patients need the following nursing interventions: monitoring the vitals, especially respiration, temperature, and pulse rate. Instituting infection control precautions to prevent the spread of infectious agents. Assisting in pain management. Assisting with getting rest in a quiet, darkened room. Implementing measures to cool the patient. Administering antimicrobial agents as doctor prescribed. Encouraging the patient to stay hydrated, either orally or peripherally. Monitoring neurologic status, ABG and ICP. Monitoring daily weight and serum electrolytes. Meningitis can be prevented by maintaining a healthy lifestyle to enhance the immune system, getting adequate amounts of rest, avoid smoking, avoiding contact with sick people. Vaccinations can also protect against certain types of meningitis. Practicing good personal hygiene, avoiding contact with an infected person's body fluid, such as saliva and nasal secretions. Avoid sharing drinks, utensils, and personal items that may carry saliva or other fluids.
According to a study conducted by Radha Ilmi and Sri Yona from Faculty of Nursing University of Indonesia, West Java in 2018, listening to Quran can be really effective in pain reduction in patients with TB meningitis. The study was conducted to analyze the effectiveness of applying Muratal Quran audio stimulation for patients with TB meningitis in Cipto Mangunkusumo Hospital. The participants were instructed to listen to Quran for 7 days. Then, they conducted a literature study to evaluate their response to the intervention. The data analysis showed that the clients responded positively to Quran stimulation. According to the results, they experienced decrease in pain intensity after implementing the intervention for 7 days. On the last day, the clients showed signs of decreased stiffness in the extremities. They appeared calm, relaxed and were able to sleep peacefully. Based on the adult nonverbal pain scale, the results indicated that the level of pain reduced from 7 to 1 score. It's known for us as Muslims that listening to Quran induces relaxation and relieves headaches. The common symptoms experienced by patients with meningitis are generalized body aches and severe headaches. That results shows how effective this intervention was on the participants, so it's highly recommended to apply Quran for those patients. It should be implemented in the hospitals as non-pharmacological pain management. Another study conducted by Gayatri Moli Purwandari from Faculty of Nursing, West Java, Indonesia, in 2018. It's aimed to demonstrate the effectiveness of implementing music therapy to relieve headaches in patients with meningitis. This study was implemented on patients with TB meningitis who were complaining of severe headaches. The intervention was all about listening to classical music, particularly Beethoven's symphony for 12 minutes each session for 3 days. Then their pain level and quality evaluated via McGill Pain Questionnaire. Based on the results, classical music relieves pain quality and associated positively with the patient's psychological status. On the 3rd day of implementation, the patients looked more relaxed, and the pain intensity alleviated from 8 to 6 in pain scale. Music therapy is considered as an effective non-pharmacological intervention, which helps to reduce the pain quality and intensity. Patients with meningitis experience mostly severe headaches related to the neurological inflammation. That's why music therapy is needed in such cases, because it's safe, effective and without side effects. Based on other study conducted by Monreal and Beltran from an urban health center, Spain, in 2018, educational intervention can aid in improving the vaccination coverage of meningitis C. The purpose of conducting this study was to show the importance of educational interventions to increase the vaccination coverage in Spain. Its retrospective observational study conducted on 351 young adults aged 20 years old. It consists of providing health education regarding meningitis and the effectiveness of meningitis C vaccine. Then, they analyzed the reaction and response to the educational intervention. The results indicated that there was an increase in the vaccination rate by 49%, and the vaccination registration rate up to 40%. There was a significant increase in both vaccination rate and its registration as impact of educational programs regarding meningitis, which helps in reducing the prevalence of meningitis among young adults in Spain. Educational interventions can be useful in improving the health awareness regarding how dangerous meningitis is, and the role of the vaccination in preventing it. Health education must be done by nurses in order to spread the health awareness and raise the vaccination coverage and registration in the community, which can decrease meningitis mortality in the target population.